Well, welcome to today's talk. It's Saturday the 24th of July. Now, I've had quite a few emails about yesterday, so I want to clarify the situation, and if I've generated more heat than light yesterday, I do apologise. So let's get straight down to it now. It's to do with vaccine longevity and the effects of the vaccine and how long they last for. Now, this is going to be based on data primarily from Israel. Now, when we're thinking about protection, the protection the vaccine gives, then we're thinking about protection against getting infected in the first place. Now, we can't often tell what that is because we don't know who's infected unless everyone's tested. So that one can be a bit tricky. The data on that can be difficult to make precise. But then we're looking at the protection against symptomatic infection, the protection against getting very sick, the protection against hospitalisation, and of course, we want to know to what degree we are protected against death. So we all want to know how protected we are against these particular possible outcomes. Now, Israel, after 2 doses, the protection against getting infection after the Pfizer vaccine, it was nearly all Pfizer vaccine in Israel. So after 2 doses, protection against getting infection was 39%. So you enjoyed a 39% protection against getting infected in Israel. But that was down from 90% originally. So it seems like the level of protection has gone down, has dwindled a lot, and really quite rapidly. Israel, after 2 doses, the protection against getting symptomatic infection is 41%. Israel, after 2 doses, protection against getting very sick is 88%. And Israel, after 2 doses, protection against getting hospitalised is 91.4%. Now, that doesn't sound particularly good. It sounds like the effects of the vaccine are wearing off, at least fairly quickly, for protection against infection, protection against symptomatic disease. While getting very sick and hospitalised, the levels of protection stays relatively high. Now, let's compare this to the United Kingdom now. Now, we don't have all these numbers for the United Kingdom here, but the chances of getting infected, as we've said, that's quite difficult to ascertain. But the Pfizer vaccine in the UK, after 2 doses, symptomatic infection is an 88% protection. And in Israel, against symptomatic infection, it was 41%. So in Israel, it was 41%. So double. So in the UK, protection against symptomatic infection after Pfizer, 88%. In Israel, 41%. In Israel, the chances of getting hospitalised were at 91.4%, whereas in the UK, it's 96%, which is in a more similar kind of ballpark, really, isn't it? But we see this massive discrepancy here between symptomatic infections after 2 doses in the UK, 88%, and symptomatic infections after 2 doses in Israel, 41%. Now, let's keep going on this. Davidovitch, Ben-Gurion University. He says this: we see that the vaccine is less effective in preventing transmission, but it's easy to overlook that it's still very effective in preventing hospitalizations in severe cases. So in a sense, this is nothing to worry about, but it is still a bit perturbing that aspects of immunity can reduce so quickly. Now, I want to go into a little more detail. In fact, let's just look at the implications of this in Israel. So here's the number of cases in the increase. So this is the 11th of July here, and we see that basically since the 15th of June. So we see over the course of less than a month, this massive increase in number of new confirmed patients of COVID-19 in Israel. And this is directly from the Israeli Ministry of Health site. So not much ambiguity about what's actually going on there. But let's put a little more detail and look at how the levels of protection have waned in Israel, how they have gone down. So now, we don't have full comparable data from the UK on this, unfortunately, but let's look at what we've got from Israel. So Israel, protection against infection, the average that we stated there was 39%. That was an average. But this is actually derived from those vaccinated in January retain 16% protection. Those vaccinated in February retain 44% protection. Those vaccinated in March retain 67% protection, and those vaccinated in April retain 75% protection. So we see with every month that goes by, there is a great reduction in the amount of protection against infection. And as we said, that averages out at 39%. Now, in Israel, protection against symptomatic disease, we said that averaged out at 41%. And of course, in the UK, that figure was 88%. So this is massively, massively lower than the 88% in the UK. So Israel, protection against symptomatic disease. Those vaccinated in January, 16% protection. Those vaccinated in February, 44% protection. Those vaccinated in March, 69% protection. Those vaccinated in April, 79% protection. So again, we see this massive reduction as time goes by in Israel for the level of protection against symptomatic disease. Now, when we look at the situation in Israel against protection against hospitalisation, January, if you're vaccinated in January, you've got an 82% chance protection against hospitalisation. If they're vaccinated in February, you've got a 91% protection against hospitalisation. Vaccinated in March, 89% protection against hospitalisation. And those vaccinated in April, 88% protection against hospitalisation. So we can see that they're pretty much the same. So the protection against hospitalisation is not waning. And the figures for protection against severe disease in Israel. So remember in the UK that the protection against hospitalisation was 96%. It's not quite as good as the overall 88% in Israel, but it's in a similar area. Israel, protection against severe disease. Those that have had 2 vaccines in Israel, protected against severe disease, 91% overall average. Those vaccinated in January, 86% protection. Those vaccinated in February, 91% protection. Those vaccinated in March, 94% protection. And those vaccinated in April, 84% protection. So we see there's not a huge difference there. So the really big difference that we see, and it is a big difference, if I can find the right screen. There we are. So symptomatic disease protection in the UK, 88%. Symptomatic protection against infectious disease in Israel, 41%. So why on earth does it seem that people in the UK have got twice as much protection against symptomatic infection as people in Israel? And people in the UK have 96% protection against hospitalisation, only 91.4% protection against hospitalisation in Israel, but that's not as big a significant difference. So symptomatic infection, twice as likely to get it in Israel. Why is this? Well, the vaccines were the same. The Israelis are the same as the Brits. We are all genetic humans. The big difference, and this has got massive implication for the States, the big difference is the timing between the vaccine doses. In Israel, it was nearly always 3 weeks between the initial primer dose and the second booster dose. In the UK, it was 8 weeks at least, or for the vast majority of people, or 9 or 10 or 11 or 12 weeks. More lately in the UK, there's been a shorter gap in some areas. Me, personally, I had my Pfizer primer dose and I had my second dose 11 weeks later. So I had 11 weeks, and I'm fairly typical of the UK, 11 weeks between the gaps. So what it's looking like, and this is the I couldn't really give you the bottom line at the start of this video because it's a bit confusing. You've got to work to it. But the bottom line of this, that is strongly indicating that the longer the gap between the primer dose and the second dose, the booster dose, the first dose and the second dose, the longer that gap, the longer the protection against infection and the longer the protection against symptomatic infection. And this has got huge implications for the United States because whereas in the UK we were vaccinating 8, 9, 10, 11, 12 weeks between doses, in the States it was pretty well 3 weeks between doses, the same as Israel. Therefore, I would expect the same drop-off in protection against infection and symptomatic disease in the United States as we've seen in Israel, as we have not seen in the UK. That means in the United States there's going to be a massive increase, if this is correct, if this extrapolation is correct, in the United States in the next weeks there's going to be a very, very massive increase in the number of people getting infections and the number of people getting symptomatic disease. Now, the people in the United States that have been doubly vaccinated are going to enjoy the same level of protection as the doubly vaccinated in the UK and the doubly vaccinated in Israel. But the proportion of people in the United States who have not been vaccinated is much greater. Much greater. Many more people in the United States have not had 2 doses of the vaccine. Therefore, they're going to become infected by this huge increase in the number of infections that we're going to get amongst the vaccinated and the unvaccinated, including symptomatic infection amongst the unvaccinated. Including symptomatic infection amongst the unvaccinated, who are going to then pass infection on to the unvaccinated. So in other words, let me say that again, the vaccinated in the United States will still be getting infections, some will be symptomatic, and they will be able to pass that on to the unvaccinated. The vaccinated are not the ones that are going to get severely ill and hospitalised. The unvaccinated ones are. That's what that data is showing pretty clearly. So there we go. So what I want to do now is reinforce that people in the United States, well, obviously they're going to get protection against severe disease and hospitalisation 3 weeks after their second vaccine, but a lot don't have that protection, so that's got big implications for the United States. But the other thing I want to emphasise is people in the United States who've had 2 doses, if they get minimally symptomatic infection, they're likely to get, according to UK data, again, and if we can extrapolate from the UK to the US, which I think largely we can, they're most likely to get a runny nose or a headache, sneezing, sore throat, loss of sense of smell. That's people that have had 2 doses of vaccine. So there they are there. In the doubly vaccinated, those that get symptomatic disease, 74% get a runny nose, 72% get a headache, 62% get sneezing, 59% get sore throat, 50% get loss of smell, as opposed to a slightly different presentation in those that are unvaccinated. That means that people in the United States who've had 2 doses have to have a very high index of suspicion that if they get these symptoms, they may have infection. They may have symptomatic reinfection, SARS coronavirus 2. For them, they're overwhelmingly likely to be fine, but they could pass it on to someone else who could become very sick, who could become hospitalised and who could die, who is not vaccinated. So that's what that means. So we're seeing a waning of infections, but we're seeing a waning of protection resulting in more infections, more symptomatic infections, and that does seem to be associated with the shorter duration, the 3-week duration between the first and the second dose of the vaccine, whereas we're not seeing this in the UK because of the longer gap. The other implication of this, if people want to protect against infection and symptomatic infection in the United States, they're probably going to need a 3rd dose of the vaccine. That's another implication of that. So I hope that clarifies that. Apologies for the confusion I caused yesterday. And not a big problem for people in the UK, speaking of the whole population. Not even a big problem in Israel, although people will have more symptomatic disease, but hospitalisations and severe cases won't go up dramatically. But in the United States, the hospitalisations and severe cases could go up dramatically as a result of the unvaccinated and the vaccinated both infecting the unvaccinated, giving them severe disease, potential hospitalisation and potential death. Okay, I think we got that the right way around this time. Thank you for watching, of course.